Hi everybody and welcome to the Start Well briefing for the PVI Early Education and Childcare providers. This is our normal, autumn briefing. What we're trying to do is normalise the information that we usually get out to you. Obviously, we're usually meeting at the Bolton Science and Technology Centre. Today we're just recording our briefing for you and hopefully going through a number of issues and keeping you updated with the national and local events as we do so. So delivering the briefing today is myself, Helen Shearer, Interim Head of Startwell Service, and I'm also being joined by Laura Wright, Early Years and Childcare Advisor. Okay, next slide please, Sam. So obviously a lot changes in 24 hours living with COVID at the moment, and last night many of you would have seen yesterday and yesterday evening further announcements from the government in terms of their response to COVID. What is really clear and coming through from government is their priority to ensure that early education and all education in schools, early years providers, universities, further education remains open wherever possible. In light of some of the changes, the current guidance that you've all been following from government has had further updates, and I think we all recognise now we've got into the rhythm of and recognising that these guidance documents have frequent updates. We sent this around yesterday via the COVID closed Facebook group, and hopefully some of you have had opportunity to see the changes. They're listed below, and sometimes it's really challenging, even when they acknowledge the adaptations and changes to a document, to actually understand the nuance and what that would mean for you. I think some of the areas that are included in the guidance that I'm just going to sort of focus on is the use and disposal of face coverings. And where before there was really clear guidance about not using face coverings when you were working with children, that still is the case. But I think one of the lessons that we've learned in Bolton over the last few weeks is that there are times when staff particularly are in circulation spaces, whether that's the use of a staff room, whether that's the use of an office space, and really where you know that it is not possible to maintain that social distancing of 2 metres, that there is a place for a face covering. And I know many of you would already have watched the Public Health and Start Well webinar that was recorded and released yesterday. There was further discussions around face coverings. So again, it is important to look at those sections and see how they've been updated, and also they need to be reflected in your risk assessments as you are going forward. Okay, some of the other areas that have been updated were covered in the webinar yesterday, and we'll also cover later in this briefing. Okay, thanks, Sam. I'm just going to sort of give some updates around the EYFS disapplications and Ofsted. Obviously, we're coming to the end of the period where we knew that there were these disapplications. And it is expected that from next week, from the 26th of September, that we will be reinstating the EYFS in full. And obviously that is the statutory framework, and it does remain a legal requirement. And what government is saying is that that must be adhered to. But they do recognise that where there have been further restrictions related to COVID due to a local lockdown or a national lockdown, that might affect the way that you can comply with the EYFS. And I know some of you at the moment particularly are being affected by your staffing and the movement of staffing because of the way that you're having to isolate groups of children and your bubbles. So we're wanting to reassure you, we haven't had so far any visits from Ofsted in Bolton, but whilst we know and recognise that the disapplication is coming to an end, there is the fact that we are in a local lockdown. So we just want you not to feel agitated by that. You're doing the best job that you absolutely can, and obviously if you need any further guidance or support or any other questions around this, please come to Start Well and we'll have those discussions with you. Okay, next slide please, Sam. So in terms of Ofsted updates, and again, none of this is really new information. It's information that Ofsted have released and we've shared with you via the EYFS updates. But they have been quite clear that their activity at the moment is going to be led by what they feel is most important for children and for learning. Interestingly enough, while we've been in a local restriction at the moment in Bolton, we have had offers of support from Ofsted to the local authority, seeing whether we needed any additional support from their officers, which is, you know, very kind. Like I said earlier, we haven't had any visits during this period from Ofsted coming in to see early years settings and providers, but we do know that they are planning between now and September to do some of these interim visits. So the registration visits and the regulatory work that will continue. They will look at what actions leaders and managers have taken since their last inspection. These visits will not result in an inspection grade, but the inspectors are going to just make sure whether they need to take any regulatory or enforcement actions if appropriate. And there will be a published summary after that visit that will go on the Ofsted website linked to each of the providers. Okay, next slide please, Sam. So in terms of the interim visits and what might happen there, they're going to select and visit providers who are currently judged as less than good, and those that had safeguarding and welfare actions that raised in their last inspection. It is, like I've said earlier, these visits are more of a keep in touch visit rather than making a judgment for each of those providers. Actions that were set at the last inspection, they will ensure that those requirements have been met, and they are also in the report that they're going to be pulling together in terms of acknowledging their visit. They're not, as I said, going to be giving a grade, but we do know that a couple of the settings in Bolton who this will particularly affect, and those settings who currently are not able to offer some early years funding entitlements because of the category that they're currently in. They have been coming to us to try and understand what the implication of these visits and these reports will be for them. We have discussed this at the early years subgroup, and we always defer that Ofsteds are the arbiters of quality, but we do recognise that it could be some time before these particular providers do get an Ofsted inspection. So it's been agreed at the early years subgroup that we will look at each case as an individual case, and we will start to pull together some protocols as how we would review what the report that Ofsted issue states, and whether we can make a decision around whether funding will be reinstated. So like I say, once that has been drawn up, it will be on a case-by-case decision, and it will go through the early years subgroup as to whether we would look at reinstating funding for those particular providers. Okay, thank you, Sam. Next slide, please. So, as I said earlier on, there's been a number of webinars that have come out, and we are now jointly with Public Health ensuring that the most relevant information around COVID is being delivered to you as soon as we can. So we've decided now to do weekly webinars. There was one that took place yesterday, and the correct link is here. I do apologise for the email that was sent out with the incorrect link, but a follow-up email was sent. I think it is a really helpful webinar that you can have as managers, but also to share with your staff teams. A lot of the issues that we're facing collectively in Bolton and across the country really do rely on each and every one of us complying to the advice that we've been given from Public Health and from government. So I think that these webinars are wider than just managers, but obviously use your judgment there. Each week we review questions that come into the Startwell bookings email address, but also the consultants in Startwell who are working so closely with you at the moment to support you in your decision making. They're also pulling together any particular trends, any particular issues that are coming through from settings, and we can use these as an opportunity to be able to answer any questions that you may be facing, and there is an awful lot in being able to share and hear those responses, and I know many of you so far have not had to face those decisions about making or closing a bubble, and haven't been in contact with people who are so far positive, but I think there's great opportunity being able to share some of that learning. So please, any question, we'd welcome that, and hopefully be able to respond to that. And just like I said in the webinar yesterday, it's knowing how useful these are, and if you feel you need any further information or talk about the frequency, we really would welcome that feedback, because we want to ensure that this is supportive for you, and we'll respond accordingly. Okay, thank you. Thanks, Sam. Next slide, please. We've also sent out the updated risk assessment. That it's a pack of information, a support pack that we've worked closely with colleagues in the local authority who advise the local authority around risk assessments. And this pack's been designed to support you. It's there to use. I know many of you have your own risk assessments, but it can be a real aid, particularly around COVID at the moment, particular issues to be able to think about. It's got a general compliance checklist in there as well as discussion templates that can be really helpful for you and your staff team. It is a generic guidance based risk assessment, so you know you have to adapt that. We've made sure that it is adaptable. It's in a Word document, so that you can see fit as to how you use it. It's up to you which elements of it that you use. Many of you that have got your own risk assessments in place might feel that it's not appropriate. That's absolutely fine. But we do know that people do welcome some support around those risk assessments. And obviously, with the changing guidance that we started, that I shared at the beginning of the webinar, it's just ensuring, and I know that it feels like a bit of a laborious job, but you do need to do some cross-checking against the guidance documents, against your risk assessments. And it's also that dissemination, isn't it? It's ensuring, you know, you can write everything down and record the actions that you're taking, but it's always making sure that staff understand what their roles are. In many cases, it's also helpful to share elements of your risk assessment with parents. That can really reassure new starters to understand the measures, particularly the protective measures you're taking at the moment. And I know that was something we discussed on the webinar yesterday, was how appropriate that is to share. I think the whole document wouldn't be right to share with parents, but there are particular elements that would support parents and many of their queries. So again, that pack of information is on the Startwell website, so we'll make sure that those links are included in the slides as we send those out to you later today. Okay, next slide please, Sam. Now, as the national documentation is changing, we're having to be quite responsive as well in terms of the documentation that we've got out to support you. And I know that over the last week and this week, this particular support package around the COVID-19 positive case action cards and the step-by-step guidance has had a number of updates, and I am sort of starting this with, and there will be another one, but at the moment you would have received, and you can again find these on our website, but I know that these were emailed out to you, the updated action card that I'm going to go through in a moment or two, but the step-by-step guidance for early year settings. We are going to be making further changes, and we're going to be aligning those to other regional documents that I'll go through in a moment. It's there to support the decision making, and I would say that the action card is really key for you to understand the process that you will need to follow if you do receive a positive test. The step-by-step guidance that has letters and other pro formas, that is there to support you in your decision making, but it is up to you how you contact your parents You don't have to necessarily use those particular pro formas, but I know that many of you found them really beneficial when you are having to be faced with so many decisions in such a short space of time, when you're faced with a positive COVID result in your provision. Okay, if we move to the next slide, please, Sam. I'm just going to go through some of the issues that have happened around nationally and locally. Last week, we heard from the DfE that they had launched a national helpline, and again, it was just the timing of some of this. It came out sort of on a Friday afternoon, and our public health colleagues and the local authority weren't aware that this was actually going to be coming out nationally. We knew nothing about this, and we'd obviously just issued an updated version of our action cards and step-by-step cards. What we have found is that, and what we have updated the action cards with, is we have put in the national helpline, and I'll go through where that is appropriate in just a moment. There've also been some changes to regional public health arrangements, and particularly because the North West has seen some of the biggest spikes in the virus. Collectively across Greater Manchester, we've come together to pool the resources in public health to try and shore up the arrangements. Now, some of you may have already seen GM processes, and if you have contacted the Greater Manchester Contract Tracing Hub, they are sending out some of that information, and we know that that can feel confusing when you're looking at their documentation and then looking at the documentation that you've had from Bolton. So we are doing some updates to the resource pack. They will be sent out later this week, and we will talk about them at next week's webinar, so that we are linking in with the GM resources, but also embedding our own local action cards within that documentation, so that if any changes have to be made, we're hoping we're only going to be changing the additional documents like the action cards that come directly from Bolton, which hopefully will support many of you in the way that you've been maybe printing off some of this documentation. So it's obviously a changing situation, but we do aim to get those out by the end of this week, and that will either come out in the early years update email or in a separate email from myself. But we'll go through the action cards now and have a little look at how they've changed. So if you move the slide on, please, Sam. So where we had before a flow chart, and obviously I know many of you who've had to sort of go through this process have been supported by the Startwell consultants and team. We do refer to the flow chart and the action card because it's sort of there in black and white what you need to do, and it is there to support your decision making. When we came to this recent update, we just couldn't make it fit on a flow chart. So this is now being put into a table format. It's got exactly the same information, it's just got the additions to it. So it's I know this is really tricky reading this off the screen, but I'm just going to walk you through some of the elements and where those changes are. So we've got down the left hand side in the lighter blue box the different stages. So it's effectively saying you find out, and A, that tracing from a positive test result links from test and trace to your setting, and effectively that means that a contact tracer has contacted your setting. That's how you found out about a positive case. I think in most cases the way that you are finding out about a positive case is that either a parent or a member of staff has contacted you in the first instance, and so you haven't necessarily been contacted by the test and trace teams directly. The actions that you need to take, so where in the right hand box it's talking about the detail, nothing very much has changed there in terms of you are still asked to email the Greater Manchester Contact Tracing Hub as soon as possible. It's obviously that you've received that information and you are ensuring that the parent or the staff member or the child has been asked to self-isolate straight away. But also when you do email the GM Contact Tracing Hub, it's the other two emails that are linked to Bolton that you need to also send the email. It can just be one email to save you. So that includes the COVID-19 contact tracing at bolton.gov.uk and also startwell@bolton.gov.uk. And what that does is that notifies regionally and locally those that need to know about the positive case in your provision. It also will ensure that once that information comes into the Startwell inbox, that you will get support from somebody from Startwell, because we do recognise that it's not always the most straightforward decision-making process that you're having to go through, and that each case can be very different. You will be contacted by a contact tracer. But we've also recognised that from the Greater Manchester Contact Tracing Hub, they're currently recruiting more staff. And when you're faced with this information that you've got a positive case, you really want to hear back from somebody very quickly. And you know, the cases, it can take a little while before you do hear back from them. So we're just sort of recognising once you've sent that email, they will be aware of that and they will contact you. What they're asking you to do is your investigations and preparing the information that you need to prepare so that when they do contact you, you have that information ready. We have added into this section that we do have the new Department of Education helpline, and what it does say there, that if you've got one confirmed case of COVID, that what is really helpful is they've got an out of hours and weekend phone line that you can call, because we've also recognised that a number of these issues or the positive test can come through at a weekend as well as during the week. So it is helpful to be able to ring them and get some guidance. And again, they will advise you to be following your local guidance. So that is these action cards, and they will sort of take information and offer advice. But the same process of sending the email to the 3 email addresses on this action card still apply. We're also looking at, as a local authority, looking at weekend cover of senior managers as well. So it may well be the case that you will be contacted by somebody from the local authority if this should happen at the weekend, and further information will be shared with you about that process. And then pretty much the action card talks through, very much like the flowchart did, around what you need to do when you speak to a contact tracer. So we've gone down to point 2 there, and the information hasn't really changed from the flowchart. There's just a little bit more detail put in this chart. 3 is the contact tracer gives you advice and what you then need to do with that advice. And when you actually then at stage 4 confirm with the local authority that you have a positive case. I'm just going to move on to the next slide, because that's got the second part of the card on there. So it follows all the way down the lines of support that you will recognise from the flowchart as you saw it previously. But there's also just some information on the right hand side around implementation in your setting. So those actions that you need to be able to take. And like I say, when you get contacted by somebody from Startwell, the support that the consultants will be giving you, they're just following and talking you through the action cards. This has become our main frame of support, but sometimes it's just we've recognised, I've heard some really sort of positive feedback from you, having a fresh set of eyes, just having somebody to be able to talk through and affirm that you're making and following the right actions has been really supportive. So thank you for that feedback, and really that's what we think is just so important at the moment as we are living with COVID. It's that ability to be able to know that you're making the right decisions. Okay, thanks Sam. We'll go to the next slide. So yesterday you would have seen in an email that came from myself that this is part of the comms that have come from Greater Manchester and going right across Greater Manchester. But obviously, because Bolton have local restrictions, we're just ensuring that this fits the Bolton restrictions. the way to beat the virus is by us all working together and being really consistent. So we'd really appreciate if you can print these posters out so they're really visible to parents. I know some settings are actually handing them out to parents so that they've got them. It's just about making them visible. So it's, again, really consistent messages. And again, it just talks parents through what they need to do. And we still need to, the quickest measure that they can do is, if anybody is symptomatic, is they have to self-isolate. That's the first thing. They have to get themselves and family members, if they're symptomatic, to be at home, and then take the actions around testing. And I think having these visual, they're going to be on our social media feeds, really having a presence so everybody gets the clearest messages, hopefully will help everybody know that they're doing and following the right procedures. Okay, thanks, Sam. So just some other issues that are still COVID related. We're still being asked by the Department for Education for the data capture, and I know we've been sending out reminders to you, and I know this has been and I recognise it's another additional bit of information we are asking you to submit. The Department for Education are really scrutinising and looking at this data. They look at the data from early years providers, and they're also looking at the data across schools as well. And it's being used to influence policy and decision making around COVID. So the more accurate the data that we can give gives a real indication of what childcare sufficiency is within the borough. The changing picture from week to week, because they're also getting the notifications from the number of bubbles and children affected through positive cases. So we recognise that it is tricky, because it's not just a simple update. You're having to follow the process and update the information in a timely way for each Wednesday. But we're just saying we just really appreciate you continuing to do that. And obviously it's how we triangulate this in terms of the policy making that the Department for Education are making, in conjunction with the data they're getting on COVID positive tests, but also the discussions that they have with us as a local authority. We have got frequently asked questions that the department sent out to us, and they're on our website, and that link will be available as well when we send the slides out. So just a big thank you for continuing to do this, and hopefully trying to explain the rationale as to why that is still so important. So thank you. Can we have the next slide, please, Sam? So in terms of announcements that have come out from government this week, as well as updated guidance, this is something that is affecting areas that do have local restrictions. And what's been recognised is that obviously when you're not allowed to meet with other people from your own household, that has had a detrimental effect on some vulnerable children and young people who are really reliant on extended family members to offer support and to support with childcare. So I'm just recognising that residents in Bolton still are not to meet indoors or in a private garden with people they don't live with. But what the new rule is saying is that people looking after children under the age of 14 or vulnerable adults will be exempt from the ban where it's necessary for caring purposes. Now, this really should be part of a consistent childcare relationship, and I know many of you have already shared that you're used to having this is around staff. I'm giving examples of NHS staff who work shifts, that grandparents have stepped in to look after children, and maybe dropping those children off at your provision and then collecting them later in the day. And it's been really challenging for some of you. This now is that we're recognising that consistent childcare is allowed and is being supported. And we've got the link down there to the full guidance, so I would say just have a look at that and a read through that. That was only issued at the beginning of this week, so it's there for you to have a read through. Okay, thank you. Next slide, please, Sam. We've also had some issues around the personal protective equipment. Obviously, when I talked about the updated guidance at the beginning of the PowerPoint, and the use of face coverings is now being discussed, particularly in those spaces where staff may meet. It's not in the classrooms or in the rooms where you're working with children, but we recognise that some people have been having some challenges in being able to get their packs of PPE. So we have still got a small number of the emergency PPE packs that we had during lockdown, and we're just saying there, if you do feel that you need that pack, if you email into policyandperformance@bolton.gov.uk, they'll be able to process your request and arrange how you are to collect your PPE as well. I think Bryony O'Connor, Head of Service for Public Health, did cover in the webinar yesterday the caveat around PPE and the fact that the face coverings that you may use sort of day to day are not considered to be PPE. The PPE we're talking about here is if you should have somebody who becomes symptomatic in your provision and you need to don the appropriate PPE while you're dealing with that. That's what's covered in the packs that you can ask for from policy and performance. And also we've just put there the information for you to be able to get further support from the Community Infection and Protection Control Team and their email there for any particular queries that do arise. So hopefully that will be of help and support to you. Okay, thanks, Sam. So getting back to sort of a bit more sort of business as usual, and in terms of the 30-hour funding codes, we're just, as ever, we're always reminding parents, aren't we, about the revalidation of their codes. We've had a number of inquiries that have come through because it has been quite complex, and I'll give you an example. We had one family who started their 30-hour funding in January. Obviously, their child had to stop attending their provision in February because of well, it was in March, sorry, because of the lockdown. The parent continued to revalidate their 30-hour code, and then when they came to starting the setting in September, had not revalidated the code, but they were still considered to be in a grace period. So we have spoken to the provider concerned and said that's absolutely fine. That child can take up their place and access that funding in a grace period, but obviously ask that parent to revalidate their code because they'd already started with the provider at the beginning of the year and had been accessing their place. This is different where we've had families who may have applied for a 30-hour code funding but not actually started their provision, and they're in a grace period. The grace period payment is only valid if the child has attended the provision previously. So we've had to be quite mindful in Bolton. We made the decision through the early years subgroup that there is no discretionary fund in Bolton. The onus is on parents to remember to revalidate their codes. There was some support offered during the COVID period that was going to run to the end of August. We've obviously passed that period now. So we would say that if you do have any particular queries around the 30-hour fundings or parents who are coming to you with queries, if you ask them to email the Family Information Service, and the email's there on the screen, hopefully they will be able to help and support them. Okay, thank you, Sam. Next slide, please. Updates from our colleagues in finance. Obviously, you've all been paid for this term based on the headcount from the one submitted last year, and many of you have made added additional children to your headcount. What they're asking now is they're requesting that any children claimed on your original headcount submission who have not attended by the 1st of October, please would you remove those children. So it's some of those children that maybe have decided not to come into provision, or they've moved to another provision. Can you just be able to make those adaptations? So we've hopefully got a really accurate record of children with claiming those funding in your provision. This will enable us to have a really accurate picture of the take up and they're saying you can re-add if they join you at a later date, but we just try to use that date after the 1st of October to give us an indicative number of who's attending and the numbers of children attending on the different funding streams. That would be greatly appreciated. Thank you very much. Next slide, please. Thank you, Sam. Throughout this whole process, we've been having conversations with the Department for Education and Ofsted. That's been happening at a regional level, but a national level, but also directly with us as a local authority. Each day now, the local authority is having conversations with the Department for Education, and this is an opportunity for them to ask us questions because of our local restrictions. But also for us to be able to raise issues. So throughout those conversations, we've been raising the impact of COVID on the sector, and we've raised now the implication for self-isolation, that obviously when you are having to close down bubbles and the challenges that you're facing around non-payment of fees, particularly for children who obviously are not covered by the funding entitlement, and parents who should be paying additional fees like for consumables. We've also raised issues around childcare places and numbers, which links into parental confidence, but also just around your ability to be able to take perhaps not the same number of children because of the way that you are having to organise your provision and the way that you have your bubbles effectively. We've also raised impact for wraparound providers and the fact that in many cases they're not actually entitled to any early years funding, and obviously the self-isolation and the closing of their bubbles has an impact on them, as it does with all of you, but recognising that in many cases wraparound providers and childminders as well aren't necessarily accessing the early years funding entitlement. We're also talking to them about the spending review, which is we've put in our submissions there, but also just raising that awareness around the funding rate, and we will get information around what the funding will be for the coming year in due course. But it's just, I just wanted you to be aware of some of the issues that we have raised. I have sent emails round asking that if you have any particular issues or questions, we'd be happy to formulate those so that we can direct them with the Department for Education. So I would say please continue to keep doing that. I know that you have your conversations with your Startwell consultants and the team, but also be really happy to receive those queries that we can forward on to the Department for Education. Okay, thank you, Sam. So I think I'm going to pass over to Laura here. Over to you, Laura.
Thanks, Helen. So I'm just updating on behalf of our SEND team. So this is some messages from Dawn and Alex and Eleanor and Joe. And they just wanted to remind you that the SEND team can offer their advice and guidance. So if you've got those children with your existing children or new children to your setting, and you want some advice and guidance to support you to meet their needs, then there's the number to call. You must just get in contact. Don't hold on. Just get in touch straight away. The team are there to be able to talk to support you. We've also got a range of supportive materials that have been developed on the early years, our early years Startwell website. A variety of different short videos and supportive downloadable resources. So just a reminder that they're there for you. To respond to queries around could we be more flexible in this term to be able to allow you some extended opportunities to be able to apply for Inclusion Fund. There are 2 dates this term. There's the 1st of October deadline and the 12th of November. So there are 2 separate dates to apply for inclusion funding. If you don't have enough information for that 1st of October date, there's a second date of the 12th of November. So make a note of those with your SENCO to make sure that you've got time to get the relevant information together. The details, if you've not done it before, are all on the website. And again, you can speak to Alex, the SEND manager, if you just want to go through some of the detail. And as always with Inclusion Fund, there are linked to professional development opportunities, and we're moving those to a digital offer so that staff can still get that CPD, get that support that they need, but they can access it in a more flexible way. Next slide, please. we have a single point of access now for SEND referrals in Bolton, and this is just to bring in together, as you know, our SEND colleagues work really closely with educational psychology and Ladywood Outreach, so now services from all of these arms, if you like, of Bolton Startwell SEND provision, the requests all go through a single point of access. So we're finding that SENCOs in schools and settings were sometimes referring to several different agencies at the same time for the same case, and this might not be necessary. So to try to streamline the process and save time, if you want to access support, you can send your early health assessment to one inbox, and a panel meets fortnightly basis to look at this and to allocate actions. So hopefully this will save some time and be more efficient to get the help and support you need in a more timely way. Next slide, please. And Dawn wanted to just raise awareness, as we all do, around the promotion of 2-year-old funded places. We've got Startwell Bolton at Home Facebook group. And as you know, we've been delivering sessions, parent-facing sessions using this Facebook group. We've had a lot of activity that's been, Startwell activity that's been turned into online sessions. And what the team have done is create a 2-year-old promotional session that can be shown daily. This is being created to include an outline of the benefits of a 2-year-old place for children, a tour of a 2-year-old room, input from a parent, an activity ideas for things parents can do at home with 2-year-olds, and a guide around how to check your own eligibility and access a place. So it's currently in development. The forum's there. We've already got that Facebook group. So this is an ideal place to put this information. We want to record this in different languages. We want to work with you, so if you feel that you could submit a virtual tour, so, you know, a show round the 2-year-old provision for parents, and provide perhaps a link to a parent who would be willing to provide an insight, then please get in touch through Startwell bookings, email, or just give us a ring, and we'd love to work with you. Also a reminder, we've got the hashtag Early Years in Bolton for any of your parent-facing social media, and parents then can search and find you through that, and it links together all of those early years examples in Bolton. Okay, Sam. Moving on to an update from our communication and language colleagues. Just to let you know that the integrated communication and language pathway is ready to be published. It's been approved in its written format. It's now being approved, and it's an infrastructure for all partners. So it's for us in terms of early years provision, in terms of those providers working directly with children. It's also a document that's used by our health colleagues, our health visiting colleagues, public health nursing. It's used by our communication and language, speech and language therapy colleagues. It's a document that's used by everybody working with children and families, and it outlines the offer for all children and all of the resources that are available for all of those partners in their day-to-day work with children and families. And then it details the extra help and more help that might be needed, and again the resources and the pathways that go through that. So everybody should be really clear about what their role is to support high quality communication and language for that child, for that family, what resources are available to support that, and clarity about what you need to do if you've got some concerns and we think that some more help is needed. So the pathway will be launched. It's a joint approach for all colleagues in Bolton, and we're looking forward to bringing you some more information about that very, very soon through a launch. So just go on to the next slide. Importantly for our colleagues in our PVI settings, our schools working directly with the children, is to have a communication champion who can really support the provision of high quality communication and language experiences, and provide that expert advice, that reassurance and guidance to colleagues within the setting around day-to-day interactions, communication with children, supporting children to become effective communicators. And the communication champion is the person in your setting who will just have that increased knowledge and understanding of those national resources and tools to support practice. And we have a termly briefing to share updates and good practice. And the next Communication Champion briefing is on the 7th of October. It's going to be recorded so you can listen to it in the comfort of your own setting, but there will be a follow-up discussion group on the 15th of October to bring you questions too. So again, thinking about how first of all, have you got that communication champion? The briefing will cover about how the communication champion role can be supported. And also we'll be exploring ideas about how we can continue to embed tools such as the Welcome screening tool and intervention tool to be able to really provide that next step for children who might be finding things more challenging. Next slide, please. While we're on communication with parents is key, and the Department for Education acknowledged calls from local authorities that the guidance for parents and carers to support them to be confident to access settings really needed to be accessible in a wider variety of languages. So just a reminder that the guidance, what parents and carers need to know about early years providers, schools and colleges, has been published in a variety of different languages, and the translated publications are available through the link. So that's something that you might want to signpost your families to. Next slide, please. In our roundup of information, just to make you aware that we have some free e-learning that's now available. This is a really high quality resource developed for us with colleagues MBK, who originally worked with us to develop business support focused on being able to provide the 30 hours offer. So the 30 hours business support planning is now, it's turned into e-learning, and it's freely available on the e-learning platform. And it's delivered by an MBK consultant, and it's around supporting you to make that the best of that funding, and it can work on several different levels. It takes approximately 3 to 4 hours to complete, and it can be completed flexibly, so you can save where you're up to and then dip back into it again to sort of make it suitable for you to be able to manage with everything else that you've got going on. You can repeat the training and you can review the training. It does cover more than providing the 30 hours. It's a broader support offer around business. So I'd really urge you to have a look at that and make yourself, make available to you through emailing the Startwell bookings, and we'll add you to the e-learning platform. The other thing with regard to MBK, we've had a conversation with them to provide some further business support sessions in October, particularly linked to the current situation that we find ourselves in with COVID. So again, just reviewing business models, supporting you to be able to try to manage the best that you can in the current climate. So that's MBK. October, we'll bring you more information about that as we've got firm dates for you. So next slide, please. This is just quite a short notice one, just a reminder, the Department for Education committed to surveying practitioners and managers and school-based providers and childminders to try to find out what the situation is regarding workforce issues and professional development in the current pandemic. They want to know how this has affected the workforce, what new CPD needs there are as a result, and there's a survey that the DFE are circulating via NDNA. So there's a link directly to the survey. They want that back. The deadline is the 25th of September, so there's only a couple of days left to complete that. But I think that it's really important that your voice is heard to be able to, it's another vehicle for you to be able to express what the current situation is and what your needs are. Next slide, please. A quick reminder around the Early Years Professional Development Partnership. This is a partnership that we are in with the DFE funded programme delivered by Education Development Trust and LCLAN. We have our 7 Bolton champions in place, and we are just receiving information about how the rollout of the programme is being reshaped because we've got a deadline now to start for January 2021. That's been moved from this term. So Just a note, if it's something that you signed up for, it's something that you expressed an interest in, it is still going to be delivered from January. So it's to firm up. If it's something that you expressed an interest in, please let us know that you're still a firm candidate. It would be a commitment from 2 members of staff in January 2021. It's level 3 based training, and it is funded training. So more information can be had if you get in touch with us. But it's just really, if it's something that you were interested in, it's still there. It's still going to continue. You just need to firm up how that's going to be delivered. I imagine it's going to be a more blended approach of learning through virtual learning and face-to-face training. So let us know if that's something you're still interested in. The next slide, please. And generally, just we are really keen to hear your views and questions, and to engage with you in any of the discussions that you want to have. So on the back of the network briefings, so this briefing and also the COVID-19 briefing, the public health briefing, if you want to discuss anything that's been covered, it's an opportunity to have an informal conversation facilitated by the Startwell team and also with any other colleagues that are on that call. So it's a Teams meeting. You can bring along anything that you might want to ask. Obviously, if it's personal, you can speak to us on a one-to-one level. But if you would feel it's something that would be good to discuss in a more of a forum, then this is an opportunity for you. If you've got specific items you'd like us to cover, it's helpful sometimes to email us in advance so that we can prepare perhaps some responses. But it's an opportunity to share some lessons learned as well. I know that my colleagues have been really able to support some settings through developing some of the learning, where they reflect back on what they might do differently moving forward if they've had to maybe partially close or think about risk assessments in the setting. Some advice about bubbles and containing the impact of the virus if trying to sort of reduce the amount of the business that has to close. So again, it's an opportunity maybe to start to discuss some of these things and share some of the learning. So it's a Microsoft Teams network briefing discussion on the 29th of September at 10 AM. So you need to book via the website or email startwellbookings@bolton.gov.uk, and it will be a live discussion. So just to get that one in your diary. And finally, we've just got useful links for you to signpost you to, and remember just to ask us anything that you need to ask us. Just get in touch straight away. Anything that you want to ask about, please just get in touch. Some of you have got linked people that are your first port of call, and that's fantastic. So some of you might directly phone Lindsay or Jane or Pamela or Donna or Anne or Susan and get directly in touch with those people, because you've got them as your link. That's fantastic. If you're not sure who to contact, then just contact Bolton Startwell Bookings website, email rather, or just give us a ring on the 338149 telephone number, and someone will get back to you. So that's it, I think, from us, and look forward to seeing you soon. Thank you.